Hello, everyone. I hope you are doing well. Thank you for having me today. This is an incredible opportunity. On behalf of the Pikes Peak Library District and the Pikes Peak Area Agency on Aging, I just want to say we thank you for your time, and we're happy to be here today. A little bit about me. With my focus on both active military and veterans, I'm honored to have been asked to moderate this panel. A little bit about my connection to the military and veteran community. My grandfather served in the military, my other grandfather was in the Air Force, and my cousin graduated from West Point, and my uncle is still working with the Air Force, and he was a graduate of the Air Force. So having such a close connection to the military community growing up, I feel that my family has allowed me to understand the community that maybe I wasn't a part of in myself. So the struggles they endure while enlisted and outside of their service to our country speaks to why KOA is participating in this event. We care about our community, and Colorado Springs has a large veteran community, so we always want to highlight and showcase the resources available to those who served. I do want to let you know also, after this panel is done, there will be time for questions. We'll have about 15 minutes for you guys to ask your questions when that time comes. So first, I just want to introduce, give us a bit of information about yourself, about your organization, and kind of an overview of what you do for our veterans within your organization. Yeah.
Hi, so my name is Jennifer Dietz. I work with the Defense Health Agency. You probably know it better as TRICARE. We're the military health benefits program for all 9.6 million active duty service members, their families, retirees, and their families, and some spouses, and that are, obviously if you're an active duty service member and a family dependent person, you might be a spouse. So, I actually, in my role currently, lead a team that investigates healthcare fraud. So don't be afraid. I work for the IG, but I really thought that it was important that somebody from TRICARE was able to come and answer some questions that you may have, and just be able to be a resource. So I will promise you, I am not the subject matter expert, but if I can't answer your questions that you have with concerning TRICARE or anything like that, I will make sure that you get to the right people. My husband is a disabled veteran. He was in the Army for 18 years, and so I do have a passion for the veteran community, and we do a lot with the veteran community outside of my role with the government. And then just in terms of TRICARE, if you are a retiree or medically retired, you may be eligible for TRICARE. And so if you have questions related to that, we can certainly cover that later.
And then what is the best way for veterans to reach you?
So probably the best way and the most resources that you'll be able to find is to go online to www.tricare.mil. That's where you're going to be able to find all of the different resources that you may need or get specifics on whom to contact. So we do have, for the under 65 population that's not Medicare eligible yet, we do have two managed care support contractors in the East region and the West region. Their contact information is on that tricare.mil site. They would be the ones to contact, specifically in the West region. Currently, HealthNet Federal Services, it's transitioning to TriWest. They'd be the ones to primarily contact if you have issues with claims, enrollment, questions on different eligibility and things like that. Certainly, if you if you have seen any potential fraud or you have concerns like that, you can always reach out to our hotline, and we'll make sure that it gets to the right people. If you're in the over 65 population or Medicare eligible, you would be covered under DFIC. The information on there is also on that tricare.mil website, and that is where Medicare will be your primary, and TRICARE acts as your supplement, essentially, and they cover what Medicare doesn't cover in terms of cost shares and co-pays type piece.
And so is your website the best place for the people here to access your services?
The website is going to be the best place for you to access services. I do have cards, so if you need a specific person to contact, you can reach out to me and I will get you to whomever is the most appropriate folks to get to. The hotline for reporting fraud, waste, and abuse on the website as well can also get you to the right people if there are a bunch of different ways. But that's probably primarily the best place to look for contact information. It has a place to ask questions through emails. It has all of the contact phone numbers, and then it also has self-service type links to take you to questions that you may have.
Awesome, amazing. Thank you so much.
you.
And I do want to apologize. I forgot to introduce myself. My name is Piper Vaughn. I'm a multimedia journalist here in the Springs with KOAA. There's a little bit of a bio if you want to know a little bit more about me. I'm born and raised in Colorado, and so my apologies for not doing that sooner, but here we are. Okay, go ahead. Continue, Bob.
Thank you, Piper. I'm Bob McLaughlin. I'm the Executive Director of the Mount Carmel Veterans Service Center, which is a 501c3. I came to Colorado Springs over 15 years ago to serve at Fort Carson, and I was fortunate enough to be able to retire and go directly into starting a nonprofit to help military veterans and their families. You know, the vision for doing this is to be able to provide a place that fills in the gaps and increase service capability for military veterans and their families. So for us, this is my 10th year of doing this. The doors of the center have been open for 8 years. So why is it important to be able to partner with organizations like the VA to make sure the gaps are filled? For us, it's about transition and employment, which is very important to include spouse employment. I built a military veteran family services center modeled after Army Community Services, focused not just on the veteran, but on the family. About a year into it, I opened a behavioral health and wellness center to do easy access to counseling and a variety of other services. If you've heard of Next Chapter, it's a suicide prevention program where we partner with UC Health for low barrier care for uninsured and underinsured as well, which is very important. And then about a year ago, my organization hosts now the State Veteran Business Outreach Center, which means that we try to help military veterans and family members that want to start a small business or maintain a small business. So the wraparound services, I think, are important. The partnerships that we have are critical. Our goal, I think, for everyone on the stage is to make sure that there's no gaps for our military veterans and their families. And then I did pass, it's on the table, it's a trifold that has our telephone number for direct service, it has our web page, and it has our address. So the 3 ways you get in touch with us is either visit the web page, call us directly, or come over for a visit to 530 Communication Circle. Thank you.
I didn't know if you had other questions.
No, you're fine. Go ahead.
Hi, I'm Kate Hatton with Homefront Military Network. We are a collaborative, so we work with the military and the VA as well as 51 MOU signing partner agencies, to include some folks up here and some folks in the audience. And what our goal is really is to make sure that people know about the resources available to them. Ideally, if they're VA and military, they get to those resources, and if it's not, what community resources are the best fit. So we also have a case management team that really does a lot to unpack everything that's going on within your family and get you connected to the right resources, ideally the first time. We also provide emergency financial assistance, which may bring folks in the door, rent or utility assistance, car repairs, things like that. But there's also often a lot of other things going on with family members. And people might not know that they might not recognize that they're a caregiver and they're taking care of a family member. And so again, we ask a lot of questions that kind of point people in the right directions, not just about what's going on with them as a veteran or a spouse or a widow, but the whole family situation, so we can ideally look at the big picture for y'all. And the best way to reach us, we have flyers out there too. Our main phone number is 719-577-7417. We do serve statewide. You don't need to come to our office for assistance. We'll work with you by, text. If you text, I try not to. Phone call, fax, email, whatever works for you, try and make it work. And we partner with others to help get you if you need to help fill out paperwork and things like that. So, and then our website is homefrontmilitary.network.org. Long name, lots of easy to misspell, but it's simple to remember. So, anything else I'm supposed to cover?
I saw some people writing down the number, if you maybe just want to repeat that number.
And it is on our cards over there too. It's 719-577-7417. 7417. You'll have to leave a message. We have 4 on our case management team. They're super busy, but they will get back to you. And somebody's monitoring that phone call, not 24/7, but every day someone's monitoring that so we can get back to you as quickly as possible.
And to access your service, the best way to do that is for them to go to your website or to call.
Yeah, that phone number you can call. We have an online assistance form that can connect to us as well. You can add a little bit of information, and then that goes directly to our case management team, and they'll follow up with you directly as well.
Amazing, thank you.
Good afternoon. My name is Stephanie Hartz, and I am a licensed clinical social worker here at the Eastern Colorado Healthcare System VA. My areas of expertise include palliative care and geriatrics, and I work mostly with rural and highly rural veterans. So the folks that live, Callahan East, the mountains Cascade West, starting in Colorado City South, then folks in the mountains and on the plains is my bread and butter of work every day. I've been at the VA since 2010. That's where I did my training for my master's program. So my passion is older veterans and their care. I am also the proud granddaughter of a Korean War veteran who is no longer with us. But he did die related to dementia. And so I think that that's where some of my passion in serving veterans comes from. I am here today to talk about older veteran resources from a VA perspective. We have many things here in El Paso County. I filled a table and a half of VA resources over there, and so I would encourage anyone and everyone to stop by and take a look. We have resources for veterans when it comes to healthy aging, and we have resources for veterans and caregivers if they need additional help at home and other VA services. I want to take a quick plug and start and just share that the Veterans Health Administration does have 3 branches. One is the Veterans Health Administration. That is, think of it as your doctor's office. We take care of veterans when they become veterans, after they leave the military. There's several clinics here around Colorado Springs, and we have our main VA Medical Center in Aurora. The second branch of the VA is the Veterans Benefits Administration. These are the folks that administer benefits for veterans when it comes to home loans, applying for VA disability, and other benefits from one's time in the service. The third branch of the VA is the Cemetery Department, and that's pretty self-explanatory. Pikes Peak Cemetery is just down here in Colorado Springs, down the road a little ways. I'm going to talk about a lot of programs today. So in general, if you have questions on those programs, information is on the program-specific brochures. My brochure specifically looks like this for rural veterans, and my phone number is on the back. Otherwise, VA, the main phone number is 303-399-8020. And from there, you can get connected to whatever health care that you need, as long as you are enrolled in Veterans Health Administration.
Thank you.
Good afternoon, everybody. My name is Marshall Bosworth. I am the director of the El Paso County Veteran Service Office. And in that role, I also serve as the County Veteran Service Officer, which was my title. The county decided to change it to director. So still doing the same job and a little bit more. So thank you all for being here today. I appreciate this crowd here and this panel for being here to hopefully help answer some of your questions. My background is I served 25 years in the United States Army. I was a combat medic. I served 2 tours in Iraq. And then after that, I was fortunate enough to get hired with El Paso County. I started out answering the phone saying, how can we help you? And 12 and a half years later, I've been serving as the director for 6 years. So I'm very happy to be in this role. I love doing what I do. So to get to what we do. Primarily what we do is we're helping veterans apply for their VA benefits. So, and I love my VA partners, so don't take this the wrong way. The VA sometimes is very hard to navigate, okay? So what we're there to do is to help you as accredited veteran service officers to get through that paperwork, make sure you have the medical evidence you need, and those types of things. So we're very happy to help and work with you to make your claims successful. The way to contact our office, if you wanted to get a hold of me, you can call 719-520-7750. That is our main number. Leave a message for me. I will get it, and I will either call you back, or if I'm not able to, I'll have one of my managers call you. If you want to contact us for those services, it's the same phone number, 719-520-7750. Or you can call or email us at vet@elpasoco.com. VET@elpasoco.com. So that's how you get a hold of us, but primarily we're here to help you to apply for your benefits, help you walk you through that process, and I want to make sure I'm answering all the questions they gave me, and I think that I have, so I'm sure we'll talk a little bit more about that as this panel goes on. Thank you.
Thank you.
Good afternoon, everyone. My name is Matt Tolarsik. I am, a physician and Deputy Chief of Staff for the Eastern Colorado Healthcare System, VA. And prior to that, I was a 21-year veteran in the Air Force, retired, and so I appreciate all that you do and all of your service, so thank you. What I do is help people navigate the difficulty of the healthcare system. And it's daunting at times, but one thing that's daunting that to me is the massive growth of the El Paso County and the 4 southern counties of the Eastern Colorado system. Overall, we have over 150,000 members within our healthcare organization, and almost half of them now are in the southern market. And the infrastructure is not down here compared to the Denver area. So one thing I've been passionate about is helping bring the specialty care and the primary care mental health to you in El Paso County and further south. And that's a huge task when you think we're almost encroaching $200 million worth of care sent out to the community. And so it is, we want to keep that within the VA system. Part of that process is partnering with the DoD colleagues, both the Army and the Air Force. And so we have our physicians working in their facilities and vice versa. And so we are working collaboratively in order to help one another provide services to all of you in this southern market. The best way to reach me is you have my name on the brochure, matthew.tolarsik@va.gov. Otherwise, the number that Stephanie had provided, but probably the easiest way, if there's a particular area you need to navigate, is to go onto the website. There you can go to the services that you need and get a phone number. I would like to give you 2 numbers that I think would be very helpful, because for us, the most important thing is you being enrolled in our healthcare system. And so if you are a veteran and eligible for care, the call center number is 1-800-278-3883. And if you are near a clinic, you can also just stop in and they will assist in registration and helping schedule an appointment. And keep in mind, because of the short staff nature of this area, we are at one point almost 75 plus days out just for a primary care appointment, and that's been going down. We're in the low 50s now. But as we onboard additional providers, we hope that we can even make it more accessible. The civilian network providers, it's not much better. So we realize that as a difficulty for you all, and we're trying to help. The other number, if you are provided a referral and you're having difficulties with it, the Office of Community Care, 720-857-5988. And they can also help navigate for you, because as you mentioned, Marshall, it can be daunting to try to navigate through the system. We're here to help you. And then one other number I want you to write down for yourself, for your family, friends, 988, really simple. It's a veteran crisis line. We have cards over here on the table. Anyone that calls, we will assist. And I'm sure there'll be plenty more questions, but we're here to help you today. Thank you.
Thank you. A lot of us around the community and in this room understand the importance of a successful military transition. So with that being said, how does someone start the process of that military transition or separation in our community?
So I'm going to pass it down this
Yeah,
way.
whoever can
because-
answer,
yeah.
whoever wants to answer, we can just pass the mics.
So I want to start by saying this. When it comes to transition, how many veterans are here? We spent our adult life, no matter how long it is, 4, 8, 10, 30 years, in a culture of ability, ready to deploy and fight. And then all of a sudden, as we're looking to transition out of the military, we're introduced to a culture of disability. Our goal is to make sure that we're guarding against that so that people in transition specifically understand the importance of what they can do moving forward, not what they can't do. So for us, for Kate and myself specifically with our nonprofits, is what is the most important thing that people are looking for upon transition? They want to be employed, they want to make sure they have the appropriate health care, they want to make sure they're housed, and they want to make sure they have a sense of community. So the earlier a transitioning military member starts connecting from DOD to VA, that's critical, but for us in the community that are not part of DOD or VA, we want to make sure that we're reaching transitioning military members early, pre-DD 214, so they know that there are services out there like the services that Kate and I have described earlier. And the VA does 3 things, right? And I'm going to use their service the next time I move. There's a nice cemetery down the street. Hopefully it's not too soon.
You can't
But-
pre-qualify.
Thank you very much. So for me, the quicker organizations that are not DOD or VA educate, inform, and motivate service members in transition, and especially their families, because we all know that if the family's not involved, especially the spouse, man or woman, is going to be like a deer in the headlights. So what we try to do is make sure families are empowered with information. Normally about a year prior to transition, we want to empower military members with information that they need: job placement, health care, VA, TRICARE, who the providers are, and of course links to the ability to find a place to live. Thank you.
And Bob, I know you mentioned that family members should be involved
Yes.
in a successful transition. Who else should be involved?
So all the organizations that are in the community that have services, we strive to get connected early. The military and the VA have done a great job since I've been doing this of making sure the gaps between what the VA can do for a veteran coming out of the military is a lot better, so that people aren't surprised by what kind of care they can get post-service. But there's a host of organizations in this community that can really help people with their individual needs.
And how does your organization fit into that transition process?
So for me, physical presence is very important. We actually have physical presence on Fort Carson, and we attend all the transition briefs so that we're empowering the service member and the family with information so they can come to us early before separation to make sure that their employment is solid, that they're going in the right direction for health care, and housing is always a challenge.
Amazing, thank you.
You're quite welcome.
Retirement is a continuum. I mean, it's oftentimes if you get out of the military at age 38, 48, 50, you're still working. A lot of times people, or some people don't, or if you, no matter where you are, if you got out 20 years ago, it's not too late to start thinking about it. And there are lots of connections, absolutely, to Bob's point, spouse, family member. If you have a relative who is part of your circle, bring them to meetings with you. It's overwhelming. It's overwhelming to go to medical appointments and not hear everything you heard, and sometimes having another person there to hear something else is helpful as well. Get to know Marshall and his team. If you haven't applied for VA benefits, again, it's not too late, and to know what resources are available to you. Bob also mentioned that the transition process itself, and probably everybody here went through a different type of transition process as it's changed over time, and that just you might have missed something. Go back and look. Go visit your VA clinic and see what they have available. Get registered. So that's all part of your kind of transition team. And get to know community resources as well. And Pamela and Roma and the Area Agency on Aging, because things happen and things change. You might have retired a while ago, but when you hit 65, Medicare becomes primary, and that affects you from a financial standpoint. It affects you from, who's the primary payer and all those things. And so getting to know what that is in advance of it is really important. So be proactive would be kind of, I went to section 3, but anyway, just have a lot of people part of your care team, community members and other folks who know the resources, and just ask a lot of questions.
Awesome. Thank you so much.
All right, I've been waiting patiently to say what I want to say. So, what I want to say is, we don't really do a lot with military retirement in our role, but what we do is the same thing that Bob is doing, is we're out at the military bases and we're briefing our services to those folks that are separating and transitioning. And a successful transition team is honestly the people you see sitting on this stage and the people that work for us. Because we're all working together and partnering to make sure that we do the best we can to take care of the service member that's retiring and their families in our community. So an example of that is, two of my biggest partners is Bob and Kate. We work with VA every day, but we also work with them. And so I have VSOs that are at Mount Carmel, so that way we have folks that are on the west side of town and the east side of town, so people have a little bit easier access to those benefits and those people helping with those. If there's somebody that may not need VA services, but there's other local services or things that they need assistance with, we call Kate and Homefront Military Network. So these partnerships are key in our community to try to make sure that we're helping them as they transition out and continue to help them until they transition to where Bob was talking about. But even then, we want to still, that transition never changes in my mind. We all get older. I feel it every day. And at some point, somebody may transition and they need survivor benefits or things like that. So continue to talk to our organizations, find out what those benefits are, and so we can help you to understand that, because it's not always easy to understand. One of the things that we do, and I don't remember if I just mentioned it, but we do start the claim process for service members that are transitioning out from the military bases locally. So unlike some in this room probably, I was fortunate enough to be part of this process when I retired 12 years ago. But we start that transition process with their claims before they get out now, if they contact us. And so we can go ahead and get the claim started, get the medical evidence together, get comp and pen exams scheduled. So I think as far as the retirement process or separation process, that's kind of the role that we play. So, again, I just want to reiterate, the folks that are sitting on the stage are the folks that are representing the people that are here to help with that transition and retirement.
Thank you. And I have to ask you, do I have any Air Force colleagues out in the audience? I felt outnumbered by Army. Okay, good, thank you. So just from experience, and I just want to kind of walk through the transition process, because when I went through the retirement, you have the Transitioning Assistance Program, TAPS, which is now a congressional mandatory process, because what often would happen, people would get out and go through all the troubles and face the challenges that we're here to discuss today. So there is a ton of resources that are discussed there. They review CV preparation and interview techniques and try to help them in this transition period. Also, a huge part of that process is helping you get scheduled for your medical examination to determine your service level disability rating, because that dictates a significant portion of your, what care you are eligible for. And so you want to make sure they do this. Now, I can't foot stomp enough. During this TAPS, you are assigned an advisor. And this is someone that will help you through the process. You're drinking out of a fire hose at this class, trying to stay awake. It's, all day event. I think it's 1 to 2 weeks now. And you could miss something that's significantly important. So having that advisor at your disposal is critical. Where the VA fits into this is one of the many is the military to VA partnership, where we have counselors that will help be one of those advisors in a different capacity. But this is a voluntary process, so they have to volunteer to be enrolled or to participate in the military to VA process. And they will help significantly in that transition period and try to help you connect to resources wherever you're moving across the country. And I think that's a huge benefit. And I'm learning more and more. I've been in the VA now going on my 6th year, and I'm learning more about the services that are available. So having them at your disposal to help you is critical. There's also a skills bridge program. I don't know, Bob, if you talked about that, but it offers the opportunity to transitioning members to go out and participate in a work apprenticeship for up to 6 months as you're getting out to help ease that transition that we're talking about today. And so that's another resource that's fairly new that I think people don't use enough. But one thing I want to foot stomp today in our organization's fit is in the GIF suicide prevention, where the military to VA folks come in, and they will do screenings of these transitioning service members, identify high-risk individuals, and try to direct them to care. And so I think you have a litany of people that are there to help, and so you just have to ask for it and be willing to volunteer to go see them, speak with them, and then see what services are rendered. Thank you.
Awesome. Thank you so much. Oh, yeah, go ahead.
I'd like to piggyback off
Yeah.
that. And so I would like everyone in this room, if you are a veteran, if you are the loved one of a veteran, have them enroll in VA healthcare. In order to access VA healthcare services, you need to be enrolled in the VA, and you need to check in with a primary provider once a year. When you have a primary care provider of record at the VA, you have access to a social worker. Every doctor has a team of a social worker, a dietitian, a pharmacist. These are the benefits that veterans earn because of their service to their country. And if you are not enrolled, it's going to be a hard time if it's a crisis and you're like, now I need the VA. I would love everyone in this room to be enrolled in the VA as soon as possible. If you access it once a year, there are benefits and resources available, and you have earned them for your service to your country.
Amazing. Thank you so much. A lot of veterans face challenges, whether it's homelessness, PTSD, other mental health challenges, or substance abuse. For example, homelessness in veterans increased by 7.4% in 2023. Working at KOAA, we've done a lot of stories about veterans who maybe do become homeless and the challenges that they face, or they struggle with PTSD or substance abuse or mental health abuse. Unfortunately, we know with our coverage that these problems are unfortunately still occurring. What kind of are these biggest challenges that are faced by veterans, and how does your agency help with those?
Thank you. I'll also foot stomp on the registering with the VA. We can help you at my organization with that as well. I think it's so important. But for us, for those who have served wherever you are in life, post-retirement, it's really access to care. You don't want to have to work hard to get something that you need. You need somebody to help you. So the most important thing that I've found in 10 years of doing this is the term peer navigation, right? You want to have somebody who's walked where you've walked, a peer, navigate the system for you so that you don't have to. So my organization certainly helps with that. We also help with enrollment into the VA. So I would say that one of the biggest challenges is gaining access to things that you need, life emergencies, And being enrolled in the VA is so critical because, I've seen over the years of doing this, so many senior veterans never applied for benefits. Doing that is important. And then many senior veterans, or not even senior veterans, retirees, never enrolled with the VA. From my experience, when we cross the threshold of getting enrolled, getting a good primary care provider, using your TRICARE plus your VA provider is a great recipe for success. So that is hugely important. And again, my trifolds are in the back. I want to be able, if something that we say here triggers something good in you to get services, come and see us or Kate to get the services that we have in the community. Is there another part of that question?
Yeah, what kind of assistance is offered to spouses and family members?
Well, the model that I run is family first. So whatever's available for the veteran is available for the family, especially the spouse, because don't lie, your spouse is in charge. In my family, my spouse is
Sink
clearly in
household.
charge. Right, so we help with spouse employment, which is critical. And we help with, I say kids, 18 to 24, with employment of a veteran, and that's hugely important. And the other thing that we can't, that I never realized, connecting veterans to purpose is critical, especially the older veterans. I'm not yet 65, but I'm getting there. Volunteerism is huge, right? Sometimes when you're retired from the military, then retired from your second profession, and your spouse, man or woman, is getting sick of you, having the ability to get out there and volunteer to do things is great. So we can do that as well. There's plenty of opportunities to get out there and volunteer. Two things I want to make mention of. On the 13th of September, my team and partners is executing the Patriot Day Give Back, which is battling food insecurity. So at my place, we're going to work with Care and Share to distribute food to active military. And then even more important, on the 15th of October at the Switchback Stadium, we're doing the annual Veteran Homeless Stand Down to help homeless veterans. So those, when you talk about volunteerism, those are just two things to get involved in this fall. Did I miss anything else?
One more.
Bring it.
What kind of advice would you provide to veterans as they maybe face these challenges as they enter into transitioning?
Get help. That's the number one thing. We live in a culture where we don't like to ask for help. There are so many organizations out there that are designed to help our veterans because you deserve it. My advice is don't be afraid to ask. You have my trifolds there. Come and see me and we can be a starting point. But that's the number one thing. If you don't know where to go, start with us and we can help with whatever the circumstances. And if we don't have the resource, we'll find the resource.
Amazing, thank you.
All right, is this on? Okay. I would echo everything that Bob said, and also I think that a couple of things that we see most are lack of awareness of resources. Is that people just don't know all the resources you have available to you, or your spouse, or a widow of a service member, a widower of a service member. Again, Marshall's team can help with some of that too, and some benefits that may be available there. But knowing what's available, and then the other kind of big thing that we see is a lot of folks on fixed incomes, whether it's just to have Social Security or a disability income, and then the expenses like rent and food and everything are kind of outpacing those benefits. And so finding ways to get creative with finances, which again ties back to make sure everything that you're eligible, apply for. You may not think you need it now, or maybe you didn't think you needed it when you got out, or you may think that somebody ahead of you might need it more than you, but at some point, when you've earned it, and two, again, there might be some point where you do reach a crisis where I really wish I had done that, and to go back and start over to apply is going to take some time. Again, we try and connect you to those community resources, and we want to be able to get you, if you can pile on and have multiple options. We're working with a veteran now who got services from the VA, needed a chairlift, got that, but it wasn't enough, but the VA would cover one chairlift or stair lift, got him connected to other resources to get another stair lift for their back stairs. So there are community resources in partnership with what the VA can provide, or what a community resource can provide. Know what resources are available to you for in-home, staying independently living. And to Bob's point about volunteering, there are organizations in town. The VA has a lot of volunteer opportunities. Silver Key has a companionship program. Maybe you need a companion, somebody who can just talk to you because you're sitting home by yourself. Maybe you want to be that companion for somebody else, or maybe you want to drive folks to their appointments. Whatever your range, there's lots of volunteer opportunities in this town. It's run by nonprofits, and we all need a lot of volunteer help. But really, I think the biggest issues are those who are just struggling with financial security, and those who are, and the cost of living, and those who just don't know what's available to them, and then are lost because you got out of the military, you lost your family there. Maybe you're isolated from your other family that lives far away. So that's where we come in collectively as that community support system to be able to make those connections for you. And yet again, just ask if you're not sure. You don't know what you don't know. Talk to somebody who can help you answer those questions.
Thank you so much.
And I think that's a great segue into what can the VA offer. I want to talk a couple specifics for older adults, older veterans. We hope everyone ages healthy. There are VA programs over there on the table. We have a program called GeroFit. If you're 65 years or older and you'd like to do exercise with an exercise physiologist in the comfort of your home with other veterans, we have that program. We encourage veterans of any age to have an advance directive, a medical power of attorney. In the event of a car accident or unknown thing, it is fantastic to have your power of attorney, your alternate power of attorney documented. Would you want to be on life-sustaining, like a breathing machine? Those are things I have VA advanced directives over there. We also have an advanced care planning group visits. You can talk with social workers and get education about what kind of care would you want, what kind of care would you not want. Those flyers are over there too. When it comes to folks or veterans that need help, we have programs such as home-based primary care. It's available in the Denver Metro, Colorado Springs, and Pueblo. If it's hard for you to get out to the doctor for whatever reason, if you're homebound, the VA can send in a team of primary care providers, including a doctor, a nurse practitioner, a social worker, an RN, a dietitian, an occupational therapist, and a psychologist to come to the veterans' homes to provide their primary care. We have vets clubs. These are community adult day health programs that the VA contracts with, where veterans can go to socialize with other veterans. We know that in order to get old, you need to be physically and mentally active. And so at the vets clubs, veterans can go socialize, have activities, and give their caregiver a break as a form of respite. The VA has a caregiver support program, both a paid and unpaid program. If you're helping a veteran, whether you're a spouse or a child, the VA has resources. Veteran-directed care is a program where if a veteran needs hands-on care for their activities of daily living, dressing, bathing, going to the toilet, grooming, then there's a program where the VA gives a pot of money based on those disabilities that would pay a caregiver X amount of money per hour so that veterans can direct their care to remain at home. We also have a partnership with PACE programs. PACE stands for Program of All-Inclusive Care for the Elderly. The VA will pay for some veterans to enroll in this wraparound program where there is a day center available. There's transportation at the centers is where they see their doctors, nurses, therapists for physical or occupational therapy. You get, excuse me, you can get your dental, you can get your vision, excuse me, care there. I think I've probably missed some of the other things, but there are many resources. We have a dementia caregiver survival guide on the table that talks about caring for veterans is a unique, a unique population. Veterans, as they age, if they have dementia, they're going to forget some things day to day, but they're going to remember what it was like to be in the war. And how do you care for someone that wakes up every day and thinks they're in Vietnam? There are a lot of resources too when it comes to palliative care. If you have a chronic illness and you need help and support for symptom management, psychological support through a psychologist or a chaplain or a social worker. Hospice is a fantastic benefits for veterans at end of life. And did you know the VA has a concurrent care option? What is that? I would love to tell you. If you If you have a chronic condition, like a cancer, that you would benefit from palliative chemo or radiation, if you're a civilian, you have to choose between, do you want this palliative treatment or do you want hospice? As veterans, you have earned the right to have the VA pay for hospice and that specialty treatment with the goal of palliation and care and comfort, where civilians have to choose. Also, every veteran is eligible for the VA's end-of-life benefit, which is if you need to live in a nursing home because your end-of-life diagnosis is not able to be cared for at home with a caregiver, the VA will pay for you to go to one of our contract nursing homes, so you get that care. It costs you nothing. You have served your country. This is a benefit for you and your family. And so we know at the VA, the veterans get as good of care as their caregivers are thriving and surviving. And so we want to make sure that we care for both the veteran when it comes to their health care and their caregivers when it comes to supporting them with resources and education, because it takes a whole village. And that is, this group up here is part of the Village for Veterans here in El Paso County.
Thank you.
All right, I'm going to go ahead and repeat everything she just said. But actually what I would like to emphasize is, what everybody is saying here, before I make my thoughts known, but VA healthcare is very important. Enroll in that. And I know that our VA system might seem overwhelmed, but just because one veteran's getting it doesn't mean another one is not going to get it. It does not work that way. Enroll in VA healthcare. You just heard a huge list of services that they provide, but if you're not proactive, that's probably one of the big issues of the challenges facing the veterans today is, are you being proactive with your own healthcare, with your own VA claim? And that's where you got to be, because we try to do these things, we try to reach out, we do outreaches, we try to tell people about the services we provide. But in some cases, if you're not seeking those services and being proactive with your own claim or your own health care, you're not going to know about them. So please enroll in health care, pass this information along to the people that you know, the veterans that you know, because that's how, if the numbers keep growing and growing and growing, then we grow the services that are here in El Paso County. But if we're not signing up for the services, then it's the status quo. So, we want you to sign up for the services, the health care, the VA services that are provided. So, the assistance that we provide in our office for spouses and families. So, when a veteran, this is just an example, when a veteran has their disability rating and they maybe have 100% for 10 years or more and they pass away, there is a survivor's benefit that is available for a surviving spouse. If a veteran gets 100% permanent and total, there's dependent education assistance for their dependents. So there are some benefits out there for spouses and family members, and we can help to apply for those in those situations. So that's what our office provides, not just for the veteran, but for their family members as well. And the advice that I would give, I kind of already gave it, but don't wait. Don't wait. If somebody gets out of the military, you know that somebody's getting out of the military, or maybe you've never filed a claim in all of these years, whatever it is, don't wait any longer. Call somebody, start those services, because it's never too late. Even as somebody that served in Vietnam, I have folks that have served in Vietnam that have never filed a claim in all of these years. And they walk into our office, especially with the PACT Act that passed a couple years ago. There's so many benefits out there that were added with that law, and we're out there to help them get those benefits. So it doesn't matter if you've never filed a claim, or if, and when you're getting out of the military, start that stuff right away. I know you have to get a job, support your family, and all those things are important, but this crowd right here is going to help do all those things. So I'm going to do a little bit of a plug too, because what we did 2 years ago, speaking of PACT Act, or it was a year ago, is we did a big PACT Act event here at the National Guard Center, and we saw 1,200 people in 3 days. And what we did is we focused on filing for those new PACT Act disabilities. We partnered with VHA, NCA, VBA. Those are all the agencies that fall under VA, by the way. But we did healthcare enrollment. We did toxic exposure screenings. We did comp and pen exams. We did all of those things and more during that 3-day event. In November, we're going to do another one. So we're still planning it. I don't have all the pieces put together yet, but it's going to be the week after Veterans Week. So I think that starts the 19th, 20th, 21st. We're going to do another event like that. It'll be a little different. We're going to schedule appointments instead of have a free-for-all walk-in because we almost didn't survive that. But we're going to do the same things. We are, again, partnering with the state and the federal, and we're going to do that event, and we're going to try to get claims filed for veterans or their family members, do compensation and pension exams, and let people sign up for VA health care and all that. So we're going to do another one of those in the next couple months, and so we want everybody to know about that.
Sorry to go backwards. I don't think I answered the family's question. So
You're
just
okay.
to say that I would say that that's what our case management team is really good at, because they don't just ask what's going on with you, they ask what's going on with your family. So they're going to look at the big picture. What's going on? You may not realize that you're also taking care of a spouse yourself, and you're a veteran, and your spouse is having trouble with some of those activities of daily living, or that things are coming down the pike, or maybe you have an adult child with disabilities that that needs caregiving, and you're wondering about what happens, if you're gone. There are a lot of things that our team is going to do to get connected, and if our team doesn't know the answer, they're going to find the right answer, or they're going to say, you know what, here's the expert, go talk to them, and we're going to help kind of unpack all that. So that's what our team really does to help with family members in addition to veterans, retirees. Thanks.
Thank you.
All right, thank you. They've hit on so many of the important salient points already. Some of the biggest challenges faced, and Kate said, you don't know what you don't know. And my line is, the eyes cannot see what the mind does not know. So there are so many resources available, we just aren't aware of them. And so that's what this panel is here today, is to help you, and don't be afraid to ask for help. As you're transitioning out of the service, you're going through life-changing events, right? From jobs, moving, insurance, finance, homes, food insecurities, whatever it might be, finding new schools for your children. There's a program for everything. You just have to ask. One of the big challenges that I see in my area is just the access to care. And they've foot stomped from the very beginning. You need to enroll. You need to get that enrollment, help get the military to VA folks to help you, stop into the clinics, marshals events, whatever it is, you need to enroll, be prepared, so when you need it, it's not an emergency. Be proactive. Also, the staffing levels is only going to improve down here in the southern area, and that will decrease the wait times for everybody. It'll be better than the community access times, and that's our goal, because we strongly believe that VA care is the best care. And then I would probably say that contacting clinics can be a real challenge, and that's one of the big frustrations I hear coming from patients, is not getting follow-up phone calls, not getting a consult scheduled. So everything is so much tech-related nowadays. You're asked to, do video telehealth appointments, and even the My Healthy Vet, you have to ask for help to have someone show you how to go on, because once you are enrolled and you have access to that provider, you can send them messages, and then it's a documented record, and they will get back to you. So if it's with regards to prescriptions, appointments, whatever it might be, that is the best way to communicate, because it's a documented medical record. And so you want to take advantage of that. Stephanie hit on so many of the resources that are available in our facility, our organization, so I don't want to belabor the point. Plus, she knows it so much better than me. Advice I would provide our veterans is it takes a village to care for a veteran. And so none of you are alone, and you just have to realize that, and you have to ask for help. So I think Bob or someone at the other end said, ask for help, because we're there for you. Thank you.
Amazing. Thank you so much. We're now going to open up the floor for questions. We have about 10 to 15 minutes left. So if anyone has questions for our panelists, please feel free to ask them. Should I bring a mic?
I was wondering, is there a fix for the community care? I just saw a neurologist and I can't get my report into my VA records for nothing, even though the VA sent me to the community care doctor. And then the services she told me that we need for me, I have to go back to my primary care doctor and convince her to get these services.
So, sir, what you're describing, sadly, is not unique, because when people go out to the community care, it's a bi-directional communication of information, right? We're communicating to them, we need assistance, here's what information we have. They do the exams and then they get it back to us. And TriWest and the contracting network providers have an obligation to get the records back, and sometimes it doesn't work as efficiently as it should. And so I provided that number for the Office of Community Care early on. Matt Owens is the director in that service, and that's something we're tackling. They're at nearly 30% staffing, believe it or not, and so they are with such a decreased ability to get appointments within certain specialties. It causes it's a double-edged sword because it causes an increased strain on that Office of Community Care to get that information out and back. And same with radiology services, getting the reports downloaded in the system, read by the radiologist. And so if you want to meet with me afterwards, I can get your information. I'll do what I can to help you with helping navigate the process. Thank you.
Yeah. Thank you, Jeanette.
Can you get hearing aids and glasses through the VA?
I had one over here.
Hi, I'm Rich Lewis with Medicare Mentors, and this is a question for Stephanie, and it's a little bit of a setup question because we've talked about this challenge that you face in the rural communities as far as transportation. Can you talk a little bit about the challenges of transportation for people, especially that are dealing with cancer and all that in the rural areas?
Yes, that is a setup. So when it comes to the VA, we know that our rural veterans, they have higher health, or they have more health issues. They live further away from health care. Some of the things that the VA is doing is that we have what's called the digital divide. It's a way that the VA can give veterans, loans them tablets with built-in Wi-Fi so that they can connect to a VA for some of their healthcare needs. Obviously, it doesn't require hands-on care, but it's a way to connect to a provider. Different veteran service organizations, VSOs for the counties, have buses, vans that they help veterans get to places. That's where the VA can help sometimes when it comes to, are they beneficiary travel eligible? The VA can reimburse veterans for their travel if they need to go by an ambulance or a wheelchair van. The VA has the ability to send that for VA appointments depending on eligibility. That's where the VA, I want to say that we can provide some things, and these great partners up here on the stages are also helpful when it comes to transportation, because it's really far to travel from La Junta to Aurora for some specialty care. So that's where a VA social worker is knowledgeable and an expert on what are those transportation benefits for veterans individually or in the community if the VA can't meet those needs.
Just to add to that, you mentioned that who's enrolled has a social worker. There's a care team. And I think a lot of veterans don't realize that when you are with the VA that you have a whole care team, including a social worker. And there are community resources available too on transportation. But sometimes we've looked outside of the box to work with the American Cancer Society to get somebody a travel to an appointment from Denver, from here. So we try to be creative and work outside of the box. Transportation can be a gap in some ways, but we all try to work together and get creative on that.
Hi, Jeff Mulligan, Air Force vet. Marshall, I had a question. I was reading the Pink Book, and there's a thing called the County Veterans Service Office and the Veterans Service Organization. What's the difference? Why is there a CVSO and a VSO? I don't understand.
So a Veteran Service Office would be our office. A County Veteran Service Officer is a CVSO.
Oh, but they both, okay. One says organization, one says office. I didn't know which one I need to go talk
It's
to.
the same thing. I don't
So
know why
an
it's listed in there
organization
twice, yeah.
like Mount Carmel is a
Right.
veteran service organization.
Got it.
Often
Okay.
these two are
American Legion,
confused.
DAV, VFW, those are
Okay.
veteran service organizations.
Okay. Second quick question for you. Can you help find a good doctor who can write a nexus letter?
Unfortunately, we are not in that business.
Okay.
Yeah.
And then a question, sorry. I don't want to monopolize.
Yeah, you're okay.
So for Dr. Matt, I recently had an emergency room visit. I didn't realize I needed to contact the VA within 72 hours after an emergency room visit. And I just got a bill for $900 from the emergency room, and I have no idea what I'm supposed to do.
Meet with me afterwards.
Okay.
We'll work it out.
Is there
I
something-
will get you in touch with someone.
Okay.
Most people don't know that.
Yeah.
And we'll help navigate that process.
Awesome. Thank you, and thank you for all that you guys do. I'll pass it. Go ahead.
Thank you.
My question is, when trying to apply for benefits, how important is it to have your original medical records? I've been trying to apply, been denied, and I'm thinking that's the answer because I don't have proof of whatever the term is you use. But luckily, I found my records, but if you can read them, because they're so faded now, what's a man to do?
So having your original service treatment records is actually very important because whenever you file a claim with the VA for a disability, the three things that they're going to look at, which is the law, is they need to see an incident in the service and they need to see a diagnosed disability. And if you don't have that diagnosed disability on active duty, then they need a nexus or a connection with current medical evidence to that incident in the service to make that a service-connected disability. So in many cases, service treatment records don't exist. There's a lot of factors that are behind that. Sometimes the service member didn't turn them in when they left and kept them and lost them in a move or whatever. Or sometimes they were destroyed at the MPRC during a fire or different circumstances. So there are some ways to work around that. They're not super effective. You know, we can take lay statements and things like that, but having those records is very important. If they're faded, we could try to make copies of them and turn the contrast up or whatever to try to bring that out. There's little tricks that we try if we can try to make copies of them. So, but to your first question is they're absolutely important if you have them.
I think we have time for about one or two more questions, but I'm sure that these panelists will be hanging out here for a little bit, so you guys are more than welcome to find them and ask questions if you have any more. We have one right here.
I've been using TRICARE for life. If I use VA, does it cancel my Prime?
No, no.
There you go, there you go. Anyone else?
Okay, yeah, well, if no one has any further questions, we'll go ahead and wrap up. Thank you all for coming on behalf of KOAA News 5, Pikes Peak Library District, and PPAAA. KOAA and myself take pride in reporting in a community that flourishes with active military and veterans alike. I am honored to have had this opportunity to speak today and guide this conversation. My personal business cards are on the tables around there, So please grab them. I do mainly focus on military and veteran communities, so if you have any stories or anything that you want to see me cover, I would be happy to be in contact with you. Call me, text me, email me, please. I would love to do any stories that you guys have for me. There are brochures and handouts with more information and resources at the tables around the room back there, so please grab them. Also, please share your thoughts on this panel through the PPLD patron comment cards. But without further ado, thank you so much for your time, and I hope you have a great rest of your day. Thank you.